20 minutes O'Hare to downtown, but the exit to Jackson is now closed for long-term construction till sometime in 2022. It's all part of that seemingly never-ending burn circle reconstruction. Outbound, the on-ramp from Jackson is closed. It's traffic. I'm Jim Talamonte on AM 560 The Answer.
Chicago's Morning Answer continues next in our 1-hour heating and air conditioning weather center. Cloudy, areas of heavy morning fog. Rain picks up later this afternoon at a high of 50. Currently 38. Next news at 8. Chicago's Morning Answer with Dan and Amy continues next on AM 560 The Answer.
This hourly segment is brought to you by Papa Nicholas Coffee. Papa Nicholas, best beans, best roast, best coffee.
If you're looking for the latest news, insight into what it means, and the sharpest opinion, there's only one station in Chicago where you can turn, and it's this one. We're AM 560, The Answer.
Top of the morning, Dan and Amy. Good things, silver linings that could come out of this pandemic that we're dealing with. There are some that we've talked about, some at least in passing, things, for example, how we will do pre-K through post-secondary education in a post-COVID-19 world.
Year-round schooling.
Well, yes, but also with the experience of distance learning.
Right.
Do we need this expense to get a post-secondary degree, for example? John Stossel, our friend John Stossel, famed investigative reporter, he put together a new video that was posted over at Reason.com on another potential positive from this, which is his addressing all these topics in the medical supply chain, as well as the effort to get antivirals and vaccines to market. All these regulations that are being relaxed, if they're good in crisis times, why wouldn't they be good in non-crisis times as well? Stossel runs through a couple of important examples.
The machines, hundreds of these machines, are currently in the United States, but
they're not allowed to test for the virus.
Not for coronavirus
because
yet.
You need FDA approval.
Yep.
Last month, the government finally said it would relax its rules. Instead of the months or year-long wait, there would be an expedited approval process. But even that took so long that few independent tests were approved.
We had some very old and obsolete rules that we had to live with.
Finally, last week, the president said, just do it. Ask us for permission later.
Normally, it's like years and years and years.
The FDA announced emergency use authorization of a new on-site test.
Now tests are being made, but that delay has killed people. Other rules prevent doctors from innovating, like trying out new, maybe more efficient ways to evaluate patients, like telemedicine.
Being able to care for people at home with video visits and with remote monitoring.
That might violate patient privacy, said the government. Only last week that officials finally say they'd allow enforcement discretion. Finally, patients can consult doctors without risking getting infections in crowded waiting rooms.
Telemedicine should have been legalized years ago.
And now the pandemic raises a new problem.
there's just only so many people that can provide care, only so many beds that exist.
Yet federal rules actually limit the number of beds allowed in some hospitals. Only last week did the president change that.
The White House is easing some federal regulations to make more hospital beds available.
And if there aren't enough doctors in your state,
we have a shortage of doctors and nurses in South Florida.
It's illegal for a nurse or doctor to come from another state to help. That violates a tangled web of state licensing rules. The president said he would
waive certain federal license requirements so that doctors from other states can provide services in states with the greatest need.
But it turns out he doesn't have the power to override state laws. Now at least some states have announced they will
allow out-of-state licensed physicians in good standing to practice in Massachusetts.
Good. But the time it took to get rid of these rules allowed the virus to spread farther.
After coronavirus passes, we should leave those rules waived. Those and many, many others.
Regulations are always presented as being in the interest of the public health to save lives. What about the regulations that cost lives, as Stossel just recounted? Think about those four categories. Processing tests, telehealth, beds at hospitals and all the talk about capacity of the infrastructure at present, and doctors and nurses, mobility of doctors and nurses to be utilized, to have that expertise utilized wherever it is most needed, particularly in crisis. And that's at the state level, as Stossel made point. There's something else, too, that perhaps could come out of this, and that is agencies being more resistant to allowing mission creep to occur. And our friend John Solomon has an excellent piece on a good example of mission creep. John Solomon, award-winning investigative journalist in his own right, founder of Just the News, justthenews.com is the site. John, thanks for joining us. Appreciate it.
Oh, my pleasure.
So let's talk about mission creep and the National Institute of Health.
Yeah, listen, this is our premier research agency. This is where we get our medical research done, where we solve cancer, where we address AIDS. But it also has a long history of wasteful spending, so much so that back in 2016, one of the most prestigious infectious disease specialists in the world, a guy from Harvard, came in and said, you know what, I took a look at our research, and 87.5% of our research looks to be wasteful. Why is it? Half the studies we fund actually don't write a report. The ones that do, half have scientific flaws that make the findings completely spurious. And of the remaining 25%, they're often duplicative of studies we've already done. What are we doing? We're wasting money, and we're putting life at jeopardy. We look back now, and what did we find out about NIH? NIH knew since 2003 that there were certain medicines that might work against the coronavirus outbreak, but they never took the time to test them, get them to clinical trial, get ready for the next contagion, the next pandemic. What did they do in those 17 years? Well, they gave us studies about drunken monkeys and what's it like to fly drunk, and could you stop kids from drinking at tailgate parties by sending them a text message? If you gambled and drank, did you lose more money? Things that really don't bring a lot of value to medical research, and which beset or delayed our ability to find solutions for the coronavirus.
Well, just a follow-up. So let's put COVID-19 aside now that we've been made aware of this research on drunken monkeys. Please detail what we found that we can apply to our everyday lives. Yes.
Yes, it turns out if you drink a lot, you become an alcoholic and your tissue degrades. I think we've known that.
Is that right?
Here's another study.
Shocking.
Just this week. Yeah. Well, here's another one. The NIH, in the middle of this contagion, in the middle of this pandemic, put out a study on Tuesday saying, if you walk more, you'll be healthy. Now, how many of us have known that for years? Why did we all get... Yeah. And you know what? They did the same study a year ago. Why are we spending money on these sort of things? That's the question taxpayers are going to have to ask as we go forward. And late last night, after my story came out, Senator Ron Johnson, who oversees one of the most important committees in Congress, Senate Governmental Affairs, it's the investigative committee of the Senate, said, you know what? Once we get past this coronavirus, I'm digging into these issues. This is outrageous.
Good.
And so why did they've known since 2003 and they just did nothing about it? I just find that hard to believe.
Yeah. So we had an amazing story by Christine Dolan a couple days ago on justthenews.com. She talked to all these researchers and said, well, listen, I see these studies in 05, 06, or 07 say we need to test drugs like antimalarial drugs, HIV drugs, antibiotics that we saw worked in the crisis of 2003. Well, there were 3 or 4 more small but known coronavirus outbreaks. We didn't do clinical trials. So we asked the researchers, why didn't you do it? And they were very candid. We made a bad call. We made a bad bet. We thought the only pandemic that would ever hit the United States would be a flu pandemic, not a coronavirus. We were wrong, and so we didn't test it for 16 years. Pretty stunning admission by these researchers.
Well, you know what? But at least I appreciate the admission. I appreciate it's a reminder that the experts, that you can be the best in your field. You are not omniscient. You don't know everything. And so it should provide a little bit more humility from the press corps, from politicians, from all of us about what we think we know and what the future holds 10, 15, 20 years down the road. So when we talk about particularly the apocalyptic left, when we talk about this is what's going to happen to the planet and this is what's going to happen here, have a little bit of humility about all the things that you don't even know you don't know.
Yeah, that's a very important point. We all should be humble. Listen, this is a serious situation. Anytime you have a pandemic, regardless of what the ultimate death rate, the ultimate statistics are going to show, we know it's dangerous. And we've spent billions of dollars planning for a pandemic only to find out we were unprepared. And I think that somewhere along the way, the brainiacs and the logistic people have to get together and not only do great brain science, which is very important, but also make sure we're doing the right science at the right moment so we're prepared for the next situation. The best thing that can come from this is that we learn our lessons and we really make a difference, and we don't just sweep this aside and move on after it's all over.
Right, and maybe we can dispense with some of the cheap shotting too. I mean, I'm not cheap shotting the Obama administration for not taking the recommendation of the H1N1 task force to replenish the N95 masks. It didn't happen. And all the experts at CDC didn't bang the drum loudly enough to have those replenished or to think about how we do testing and the possibility of a pandemic and to build out that infrastructure over the last 15 years. They didn't do it. They didn't have the foresight. But that doesn't stop anybody on the left from cheap shotting President Trump, who's been here for 3 years, from everything that we didn't do for generations that he's supposed to do in 3 weeks.
Listen, I think the truth of the matter is every one of us in every one of our professions have some culpability in this lack of planning. We knew the movie Contagion. We knew all these things, right? We, as everyday Americans, weren't psychologically prepared for this. The hospitals weren't stockpiled for the sort of pandemic they were told to prepare for. The NIH wasn't testing the right things and wasting a lot of money. Congress wasn't providing oversight, whether a Democrat or Republican. I think when we all, and one of the great things about America, when we do it right, we all take our culpability and we all pitch in and we try to get it right. And I think while the politics and the media are still toxic in Washington, you look around the country and you see what people are doing. They're turning their factories around to produce masks in real time, create hand sanitizer, do things that will make a difference. We should focus on what we can make a difference now, and then later we should all own up that we failed together and fix it for the next thing. That's the best thing America could do. All the political shots aside are just a waste of time in this pandemic.
Here's something, we have to also understand why we didn't do the things we were warned to do. And there was a really good piece in the Dispatch by Paul Miller, who's a professor of practice at Georgetown University.
Right, very smart man.
And he talks about the National Intelligence Council warning back in 2004 that a virus could put a halt, a pandemic could happen that would put a halt to global trade and travel during an extended period of time, prompting governments to expend enormous resources on overwhelmed health sectors. Sound familiar?
Prophetic.
Yeah, it was very prophetic, and he goes into some detail about it. And I spoke on my syndicated show last night with Michael Lynn from University of Texas on this. And so the Washington Post reported on it as lately as of January and February of this year, and there's been reports on this report for 15 years. Why didn't we do anything? Because it's sort of what you're saying. There's no incentive to go out and spend a significant amount of money on building infrastructure for something that people can't see or can't conceive of and doesn't happen year after year after year. It becomes more and more difficult to justify with all of the exigencies of everyday real life that we can see. And so it gets, put down the list of priorities. And maybe one of the lessons is, take some of the deep research by people who know something to heart and think about some long-term planning and underwriting the infrastructure that's needed to prepare long-term for for threats like pandemics. Even though it's going to be difficult to sell on a rolling basis to the American public. Now we have actually a frame of reference to say this is why it's so important.
This is our 9/11 moment. And if you remember all the warning signs we learned after the fact that were surfacing in 98, 99, 2000, 2001 about terrorism and a major attack on our soil, it hit us and then we took action. We have almost an identical scenario. There are 15 years of warnings about pandemics and unpreparedness and lack of supplies, lack of testing, lack of clinical tests. And yet we didn't do anything. This pandemic, hopefully, if there's any silver lining to it, is that we will man up and woman up and we will get these issues resolved. They're not that expensive to get to this level. We've spent lots more in the last few days in trying to solve the issues of the pandemic than we could have in prevention many years ago. But it takes a will and it takes a focus and it takes leadership. And I think that we have to come out of this pandemic with the sort of lessons learned and actions completed that we didn't do in the earlier pandemics where we dodged a bullet.
He is John Solomon, award-winning investigative journalist, founder of Just the News, justthenews.com, and I'll post his piece at Dan Proft about the NIH for your perusal. John, thanks so much for joining us. Appreciate it.
My pleasure, guys. Be safe and be healthy.
You too.
Yeah, thanks. And he joined us on our turnkey.pro answer line.
Connect with Dan and Amy using the AM560 mobile app. Download it today at 560theanswer.com/mobile.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
And another way to protect yourself is to boost your immune system. And doctors say to